Bihari Gracie is asking that is Vasa concept useful in stroke patient with post hip replacement?
If TBI has affected on the both sides, you can still do Vasa concept, and it's still good for the patients.
Yeah, Isha is asking that there is a CP patient who was treated with other concepts for last 15 years and still unable to walk or sit. Can it be treated with Vasa concept?
I think that you can try always to do Vasa concept.
Yeah, and Disha, I must tell you that you should apply Vasa concept for this patient. That will definitely bring some change in the patient's condition, that's for sure. Because yesterday we had a patient who who was a CP and started Vasa concept after 15, 16 years of time. And now he's recovering well, he's sitting well, he was playing the piano and all. So I think Raj is the name. So definitely, and it can be helpful. I think, yeah. What is the main difference in Vasa concept from other concept like Bobath? I think you
I think,
answered. Yeah.
yeah, I think that I have answered for this already, but it is that we are treating the root.
Yeah. This is asking. Ayushi is asking: is it only for neuro patients? Does it involves NDT or Bobath exercises too?
Patients are doing only Vasa concept, not Popat or something else at the same time.
Is this helpful in spinal muscular atrophy in kids?
Atrophy is also degenerating diseases.
Shall we take questions for next 5 minutes and then we will wind up the show? Is that fine for you?
Yeah, that's very good. Thank you.
Friends, please don't write any more questions in the chat group. We are already having so many questions. We won't be able to cover all of them. So we are trying to cover maximum, but now do not write any question. You can ask tomorrow as well. Ma'am, this is the question from Bhushan Patni. Our daughter Navya is a Vasa concept student. We are facing problem with her stamina. Can you suggest way to improve her stamina so that she can do exercises for long duration?
If the daughter is doing a Vasa concept, I think that Dr. Vasa is part of this rehabilitation. So it's good that you are talking with this thing with Dr. Vasa. I don't want to be in the middle of there. So
Yeah,
contact to Dr. Vasa straight away.
Ravish is asking Vasa concepts affect our psychological structure. If yes, how it works?
It's also part of the when we are treating the roots, then the brains are starting to work and send the messages in the right way, and of course it is affecting the whole person. It is affecting the mental side and it's affecting the neuropsychological side because the brains are starting to work.
Rima is asking, ma'am, how Vasa concept help in bladder and bowel activities?
It's also part of that when brains are starting to work. Of course, they are sending much better influencing on our inner cuts that how it should work. And that is the reason. Brains are sending information on much better way.
Yeah. Manoj is asking, can Vasa concept regenerate the lost neurons or working on alternate pathways?
I would say that there's the alternate way. There's lots of neurons in the brains that we are not using, and cerebellum is there's so much neurons in cerebellum that we can use those.
Okay. Vinaya is asking, does Vasa concept help facial palsy associated with hemiplegic patients?
Yes, that was easy to answer. Yes, I have seen that.
Actually, it is a quick question round, rapid fire session, because we are having just 4 minutes left to find up the things. What is the
Yeah.
recovery rate of Vasa concept for stroke and CP? Does import improvement occur in all patients?
I don't know the recovery rate. I don't think that anyone has done research like it. But I have seen improvement for all patients who have done the exercises. It doesn't matter if there's 1 year or 10 years from the brain injury. If you are doing the exercises and you are doing those daily, then you are having the results. So there comes improvement. But the key is that you need to do the exercises and not to do all the things that may not be good for you.
Yeah, Raj, means Rajeshwari is asking. She asked the previous question about the Evan disease, ANAVN, and you said that you don't know about that, and she has explained the disease itself. Okay, the Evan disease is a rare inherited disorder that damages the ability of nerve cells in the brain to send and receive messages. Group of genetic disorders called leukodystrophy, leukodystrophies.
Okay, thank you for explaining this. I will do Vasa concept for with all my patients, but I don't know about more about that disease. So actually, I
Uh,
cannot tell more. I do that with all patients, and I have had results.
Yeah, means this is again a brain disorder, this condition which is related to the brain problem. So, does this concept be helpful? What do you think? So, that's what I think Rajeshwari is asking for.
I always tell that try. Then you know is it helpful or not.
These are vague questions about the time frame. How much time does it take to recover? It is very subjective and it varies from patient to patient. There is no
Yeah.
point. Uh, yeah, Ruturaj is asking, can it help in higher function disorders or just a spasm or a spasticity? I think a spasticity is a better word than a spasm.
The Vasa concept is very good for treating spasticity or ataxia or all that kind of like things.
Apsa is asking if there is sensory impairment, how you will get it back with Vasa concept.
I showed the one picture what needs to happen in the body that you can have the sensory and you can have the movement, and you need to fix the whole body that you can see the difference. So the sensory impairment is you are able it is coming better if you just do the Vasa concept. It is because the roots are fixed.
Yeah, perfect. There is a question on Parkinson disease already you have given. It can be applicable. And Dr. Vasa is telling live life king size.
Yeah.
Can we do this type of exercise in lymphedema patients?
At least I have done. I think it depends how big the lymphedema is.
Ma'am, we'll take last question and then we will wind up the show. Is that fine?
Yeah, that's good.
Yeah. Rajeshwari, you are asking about, please take your question tomorrow. But already we have answered your questions, answer. So please consider that. Yeah, Malik is asking how Vasa concept improve cognition in TBI patient.
I think that I have already answered this because it's same that in stroke patients, that when your brain are starting to work, then the cognition is getting better. And I told it beforehand that speech and the neuropsychology is the things that I would like to do research about, that how doing Vasa concept exercises you are getting benefit for everything, to your speech, to cognition, to everything. Things are happening, everything happens, but it is when we are fixing the root, everything emerges automatically.
True. Yeah, and thank you, Mari. I really appreciate the way you are giving your time to us just for upliftment of our knowledge. Thank you so much. I thank Dr. Rajul Vasa and Vivek sir and the entire RVF team. Thanks a lot, all the viewers. See you tomorrow evening once again.